Laparoscopic gastric bypass is the commonest operation currently performed in the United States. It's been around a long time. It's got a track record of about 40 years and it's got excellent long-term weight loss. You can expect to lose 50 to 60% of your excess weight and maintain that over a 10-year period. It's technically the most difficult operation to perform and isn't as often done here in Australia as in the US. I tend to reserve it as an operation for diabetics or for people who have had a gastric band and don't like it or can't live with it and want to convert it to something else. I can convert a gastric band patient to a sleeve gastrectomy, but that has to be done as a 2-stop operation. So you come in, you have your band taken out, you wait for 3 months, and then you come back and have your sleeve. With the bypass, we can go straight to a bypass from a band operation as a 1-stop operation. As I say, it's been around a long time in the United States, and it's been done with keyhole surgery for about the last 5 years. It is technically the most difficult to perform from a surgical point of view. It is particularly good for diabetics. Diverting the food stream away from the duodenum and jejunum produces an improvement in your diabetic control within a matter of weeks before you've actually lost significant amounts of weight. It's called the incretin effect. There is some evidence now that the sleeve gastrectomy may be as good, but on the whole the body of evidence still supports the bypass over the sleeve. For my diabetic patients, the majority of them still would choose the sleeve over the bypass, I think because in Australia the bypass is still considered an extreme operation. Having said that, I've got plenty of patients who've had bypass surgery who've had excellent long-term results. The bypass does require a reasonably strict diet. If you eat sugary foods, particularly chocolate, shakes, that sort of thing, you will get dumping syndrome following a bypass. What that means is that you will get crampy tummy pain, you'll feel really quite unwell, and then that will be followed by profuse diarrhea. Some people regard dumping syndrome as being useful, and certainly I've had patients in who felt that they themselves would not be able to maintain a healthy diet and avoid Coke and ice cream, and for that reason we've recommended that they have a bypass, and that keeps them on the straight and narrow, so to speak. The bypass does require long-term follow-up, particularly monitoring of your calcium. You'll be on iron medication for the rest of your life and on multivitamins. You may require vitamin B12 supplementation, which is usually given as an injection every 6 or 12 months. There's a long-term risk of internal hernia formation of about 5%. What that means is if you get any crampy tummy pain, particularly after eating, it's an internal hernia until proven otherwise. And sometimes the only way to prove this is to bring you into hospital and have a look. It doesn't always show up well on the scan. The bypass operation is not good for smokers. There's a risk of ulceration, where the stomach has been replumbed into the small bowel. That can form an ulcer and that can bleed. So you're required to stop smoking if you're going to have a bypass. And obviously stopping smoking is good for you in general terms. So certainly in my opinion there is a bunch of patients who can benefit from the bypass, but it's done on a selected basis. There's an information sheet here on the website, have a look, and certainly we can put you in touch with patients who have had a bypass surgery either for their diabetes or as a conversion from a band operation.